The reality of menstruation during pregnancy. Separating fact from fiction. It's possible. Some women may experience menstrual bleeding during pregnancy, although this is relatively uncommon. Implantation bleeding. Light spotting or discharge can occur in the early weeks of pregnancy and may be mistaken for a period. Miscarriage. Menstrual-like bleeding during pregnancy can be a sign of a miscarriage and requires medical attention. Subchorionic bleeding. Bleeding can occur between the uterus and placenta, which may cause heavier bleeding and cramping. Placental problems. Bleeding can be a sign of placental problems, such as placenta previa or abruption, and should be evaluated by a doctor. Ectopic pregnancy. A pregnancy in which the fertilized egg implants outside the uterus can cause abdominal pain and vaginal bleeding. Preterm labor. Contractions and vaginal bleeding before 37 weeks of pregnancy may be a sign of preterm labor. Cervical changes. During pregnancy, the cervix may become softer, which can cause spotting or discharge. Infections. Yeast infections, urinary tract infections, and sexually transmitted infections can cause vaginal discharge and should be evaluated by a doctor. Ovarian cysts. Ovarian cysts can cause pain and vaginal bleeding during pregnancy, and may require medical attention. Hormonal changes. Hormonal imbalances can cause irregular bleeding during pregnancy and should be evaluated by a doctor. Irritation. Sexual activity or a cervical exam can cause irritation and slight spotting during pregnancy. Consult your doctor. Any vaginal bleeding or discharge during pregnancy should be evaluated by a doctor, as it may be a sign of a problem. The reality of menstruation.